Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. First of all, let me introduce myself. My name is Nisa Nur Anasar. I am a lecturer at the Public Health Department, Universitas Siliwangi, Tasikmalaya. Honorable Dr. Asep Abdurrahmat MKes, as a Dean of the Health Science Faculty, Universitas Siliwangi, Tasikmalaya. Honorable the speaker from the Vietnam and USA, thank you for being willing to be a speaker in this webinar today. And to all of the organizing committee, Himpunan Mahasiswa Kesehatan Masyarakat Universitas Siliwangi, thank you for planning the activity well. And to all of the audience, thank you for participating in this webinar today. In this lovely morning, I would like to thank for the opportunity that I been to be a moderator who will guide the webinar session. And the topic for today is implementation of new normal in Indonesia, USA, and Vietnam. And the purpose of this webinar is to provide the information on implementation of new normal in various countries so that we can learn the positive things from the other countries to be implemented in our daily life in order to improve the condition in Indonesia. As we know that our government has made a regulation to control the pandemic of COVID-19 since President Joko Widodo announced the finding of positive case in Depok on March 2020. After that, the COVID-19 was decided to be a national disaster on 14 March 2020. On June, our government has made a policy to implement the new normal in Indonesia. And as of the pandemic of coronavirus infection disease 19, new normal is a term to reverse the behavior change in human, including limiting the person-to-person contact. But actually World Health Organization on 13 April 2020 has established the appropriate term to reverse the condition after pandemic, and that term is new norm, not new normal. And now we will learn together about how the implementation of new normal in Indonesia, Vietnam, and the USA. So there are three speakers here, and before starting the presentation from this first speaker, I will read the curriculum vitae of the first speaker. Please. Udah masuk? Vitae-nya? And for the first speaker, everyone can see the curriculum vitae on the screen. His name is Dr. Haji Asep Supriyana Abdurrahmat MKes. He was born on Bandung. He lives in Kirana Resident, Tasikmalaya, and he was finished the doctoral program in Universitas Airlangga Surabaya, and he is a dean of the Faculty of Health Science Universitas Siliwangi now. Okay, for Dr. Haji Asep Suryana Abdurrahmat, time is yours. And the time for presentation is about 25 minutes. Thank you.
Thank you very much, Ms. Nisa Nur. Morning, everybody. Maybe for my colleagues from USA this evening. Yeah. So I'm very glad here to discuss and sharing information about how is new normal implementation in Indonesia. So in this time, I will not explain about the data or something else about the COVID-19 in Indonesia, but now I will be explain about how is new normal implementation in Indonesia and what the social impact with this the regulation. So, okay, uh, I have a slide, but not very much. It is a little bit of information about new normal. First of all, I introduce myself that I'm a dean of Faculty of Health Science in University of Siliwangi, and then I'm a chairman of Center of Information, Communication, and Education COVID-19 in University of Siliwangi. So I will start with my slide. Okay, next, please. Okay, next, please. Maybe what is new normal? We just confused about the real definition of new normal. So that maybe for, yes. I just use my slide. Okay. We have any definition in new normal? What is new normal is maybe in a different country, different region, there are many definitions. So I try to conclude a simple definition. So new normal is some effort to maintain physical health and productivity amid the COVID-19 pandemic by changing habit in daily activities. So that there are many activities, new habit in our daily activities that actually this is not a new one, but maybe is forgotten to do in this era because very we face a different condition. So I think the new definition is maybe using old norm, old fashion, that's suitable to our condition now. Jadi, so new normal is only some effort to maintain physical and health productivity amid the COVID pandemic. And then, why the new normal is very important? The reason is, first of all, we face a community boredom. People or society have been a long time live in maybe fear, maybe limited activity, so that they live in a little circle without any variation. It will be lead to bore, something, boredom and something else. So that because of the limited activity, it is in fact is our income is decreased. We face an economic collapse. Yeah. Why? Because we have no significant pattern how to live or how to active in pandemic period like this. Because of income collapse, so we have a limited resources. Why? Because most people only have earn money for food or something else just for today, maybe for tomorrow. So that we face many limited resources. We don't have any money. We don't have much food for maybe for a month or 2 months or something else. And then it become to social crisis. We face many crime. Yeah, we have increased number of crime. We face unemployment people. Yeah, new employment people. something else, because this is very difficult time. And the other reason why the new normal life is very important, it is one of our control how a clean and healthy lifestyle be applied by the people. So that's this is very important in Indonesia to apply the new normal life. Yeah. This is many regulation about a new normal life that had been issued by the government, maybe for central government or district government. First, government regulation number 20 in 2020 concerning about large-scale social restriction. So this rule apply to all of Indonesian people that in the case if the area is maybe the number of COVID is increased. And then the decree of Minister of Health in 2020 issued the guidelines for prevention and control of COVID-19. And then the decree of Minister of Internal Affairs in 2020 issued the new normal for the government employees, the rule of how the government employees work from home, yeah, and separate in half section, and that's 50% work from home and 50% work in the office. And there are many regulations related to the new normal that have been issued by each region, both the provincial or district or city level. Why this is many regulation that issued by provincial or district is very different between one and another, because the condition in one provision is very different with the condition in the other provincial. And so in the district, in one provincial, we face that one district very high number of COVID-19, but in the other hand, another district no cases on COVID-19. So the regulation very different. Yeah. And then from any regulation that had been issued, we note a point of a new normal in Indonesia. There are, first of all people must wear a mask or face shield in public space. Even though that we have a regulation that if someone doesn't wear a mask yeah, in public space, it will punish by the government with maybe maximally 150,000 rupiahs. It is equivalent with 10,000 US dollars. Yeah, for people who do not wear a mask in public space.
Kan benar.
Diligent washing hand with soap or wipe with hand sanitizer. In every building, in front of the building and in every room, we must place hand sanitizer, or in the front of building, we place a facility to washing hand with the soap. And then keep a minimum distance, yeah, of 1.5 meters between each other. This is yeah, maybe a little bit difficult to apply because not every activity can be distance 1 or 1.5 meters. And then the point of new normal, reducing touching of the eyes, nose, and mouth. This is very important because only everybody must concern with this regulation. And then close your mouth when coughing and sneezing. Regularly optimum exercise, eat food with balanced nutrition, resting enough, and routine health check. This is the note of point of a new normal in Indonesia. So if we look this point of normal, this is only a term of clean and healthy lifestyle. How the implementation of new normal in Indonesia? This is very interesting, because many people still do not implement the new normal rule in their daily life. As the picture, you can see that many people stay very close each other, do not mess, and something else. That they don't not implement the new normal rules. And the second, the government is having difficulty implementing new normal regulation because the government have a limited resources to fulfill the implementing new normal regulation. And the other hand, industry, trade, and offices have not fully implemented the new normal protocol because they aim to productivity. So, yeah, they abandon new normal protocol. Why? The implementation is very hard in Indonesia. Actually, we face an obstacle. For instance, loss of public trust to government. This is heaven, but because many regulation that issued by government, people feel this is not suitable for them. This is not just make they do not free to active to do the activity. So people doesn't trust. Most of people doesn't trust the government regulation. And the second, there are a lack of public awareness. They don't care about himself or another. So in Indonesia now, there are many people do the activity as usual, as like before pandemic COVID-19. And then we have a difficult to change habit that have been running for long time from our childhood. Actually, usually we do something, do our hobbies, do our activity. That now this is all of this must be changed. It is very difficult. Yeah, we don't have any preparation to changing our habit, our hobbies, and so on. And then we have a limited of fun. On the other hand, we face unclear standardization. So, for instance, what kind of face shield that we must use, or what kind of mask that we must use in public space? There is unclear standardization. We have a mask for pediatric, for maybe yeah.
Ngerti anjir Bapak.
We have any kind of a mask. Yeah, we don't have a standardization actually clear. And then not all aspect of life can be done with the new protocol. For instance, like I said before, that people in the market, traditional market, they can apply the new protocol actually. Yeah. And then, what is the social impact of the implementation and obstacle that we face? First of all, there is a hesitant to do any activity. We do not fulfill of, we don't have good faith, but this is good for us, or this is forbidden. We hesitate to do anything. We afraid, yeah. We afraid. do not maybe faithful. And then we have face decreased productivity and economic flow. Yeah. The circulation of money, the circulation of financial is very, very slow. And then we have a suspicious to everyone. Yeah. This is very, very dangerous. Suspicious to everyone because we don't know. Our friend is health, our friend is carrier, or who is very, very health, who the carrier one. It is very, very dangerous to suspect to everyone. Yeah. And then increase hoaxes, as we know that social media contribute many, many hoax. Increase health costs and consumption of God. Yeah. Increase health costs. Now we must pay to mask, we must pay to more hand sanitizer, we must pay for more disinfectant and so on. So health costs very, very increased. And then the last one, crime and social problem are increased. As I say before, that we face increasing many unemployment, increasing crime in Indonesia. This is from the implement as a rule. Last this is my awareness that if new normal fail, we must know that this is. I'm afraid a second wave pandemic will be occurs. Yeah, millions of lives will be lost, and the economic collapse. And the last, the destruction of the social and state order. This is maybe in the information that I have to share with everyone, everybody, and my colleague from Vietnam and USA. Maybe the rule, the implementation, the obstacles to apply a new normal life in America, in US, and in Vietnam is very different our country. So I have institution, we have new information, that can raise our ideas, yeah, to handle pandemic and new normal life. Maybe this is my presentation. Thank you very much for attention. I back to moderator. Thank you very much.
Okay, thank you very much for the presentation from the first speaker. And the next agenda is presentation from the speaker from the Vietnam. Hello, Sarah. Are you ready for?
Yes. Hello, Nisa. Thank you, Dr. Asef, for your presentation. Can you hear me?
Okay.
I'm sorry, before starting the presentation, I will read your CV, okay?
Okay.
For all of the committee, please show the CV on the screen.
Okay.
Okay, please slide. Okay, everyone can see the CV of speaker from Vietnam. Her name is Ho Thi Puong Dinh, nurse, master of public health. I'm sorry, it is difficult for me to mention your name, but I usually call her with Mrs. Sarah. And She lives in Vietnam, and she is a lecturer at the Epidemiology Department, Public Health School, Nam Dinh University of Nursing, Vietnam.
Yeah.
Okay. And she has finished a Master of Public Health at Hanoi University of Public Health, and then so many experience in research and others of the second speaker. So everyone can see on the screen. And so we will continue to the next agenda. For the Mrs. Sarah, time is yours, and the time for presentation is about 25 minutes. Okay, thank you.
Thank you, Nisa. And I don't know why I cannot start a video call. So I'm sorry that I cannot turn on my camera. I don't know why, but maybe there is a problem with my computer. So I will share the screen and I will go direct to my presentation. And sorry for its inconvenience that you cannot see my face today. Okay. Yes. I heard the presentation of Dr. Asep about the new normal life in Indonesia. And yes, the new normal rules in Vietnam are aligned with the sharing of Dr. Asep. But actually, the COVID situation in Vietnam is quite different with the situation of COVID-19 in Indonesia. So firstly, I would love to share some like update about the COVID-19 situation in my country. And during that process, I will talk about the regulation, the rule, and the prevention methods that were taken in place in my country. Yeah, so I am a nurse and have a master of public health. I'm working in epidemiology department in the Nam Định University of Nursing in Vietnam. This is the only one nursing university in my country, and we have some three kinds of students. We have public health students, we have nursing, we have midwife and nutrition. Okay, that is some information about my institute. And the next one, the COVID-19 case in Vietnam, with the updates of July 28, with the total confirmed case that stand at 431. And we have that's only, I'm sorry, I have not yet updated the maybe 66 active case. And besides of that, there are a lot of people are under the quarantine. About the more than 11,000 people are under the quarantine. Yeah, we have we are running the quarantine in hospital in and also in the government campus, government running campus, and also at home. Until now, we have 0 death. Um, when a lot of people, when they see the data in Vietnam, they they ask a lot of questions, and some of them don't believe that the Vietnam does have a little numbers of COVID-19 case, and even we don't have any death, and they make a question that whether if the Vietnamese government hide the real data about COVID-19, but based on our knowledge, this is a very contagious virus, so it is very difficult, it is very impossible to hide the real data, because the transparency and the real data, the accurate data, it play the key role that have the governments and the citizen decide the protection methods that they should put in place to protect themselves and also their loved ones. So yeah, that is a very accurate data from my country, Vietnam. Okay, and is Vietnam's high risk areas of COVID-19? Yes, actually Vietnam share, Vietnam is very high risk areas of COVID-19 because we share a very long border with China. So even when we are doing very good job at the airport, many of Chinese they enter my country illegally by some ways. And besides of that, we have a huge number of Vietnamese people return to Vietnam to avoid the pandemics or due to their jobless and the consequence of pandemics. So every day we are facing with a lot of imported case. Yes, and we are doing a very like a huge of work to protect to help her to early detected the imported case and put them in the quarantine place. So Vietnamese government, because of that is why I say the difference between Vietnam and Indonesia, because we have 100 days without local transmission. Just during 3 months, we did not record any new case. So the life returned to normality until that some days ago. We have thus record some new cases, and now my country have returned in alert situation. We active all the the response system in my country to deal with the new situation. And Vietnam's records the first 2K in very early on Daniel reached on 28 from the flights on flights on China, and Vietnam lift the social isolation methods at the end of April. So after nearly 1 month. Uh, and Vietnam also successfully produced COVID-19 test kit with 19% accurate, and which is approved by WHO. Every country have a different resources and pathways to put the action into place. Like for example, like Korea or Australia or USA, you can do massive testing, but Vietnam don't have that positions to do a lot of tests for everybody in the country. Yes, so I just want to say that Vietnam received some compliments for their successful efforts to contain the virus. That is some some opinions from the people's that I cited from the articles, and that is the reason why we are doing a good job in containing the virus, because we had learned the lesson from past and epidemics in SARS epidemics in 2003. Vietnam is the first country in the world successfully contain the virus and eradicate the virus in the country. So we learned the lessons and the methods from that epidemics, and we also apply in this COVID-19 pandemics from very early. And okay, Vietnam have received compliments from their success to contain the virus. Okay. There are some methods that help us to make a success story in disease control. The first thing is the commitment from the governments with a multi-sectoral approach. And the second is timely, accurate, and transparent risk communication. and we have an active surveillance and intensive isolation, quarantine operation, and case management with chasing all new rivers and close contact up to 3 clusters. And we also suspensions of flights, shutting schools and all non-essential service. And during some months of the pandemic, we have to say that we have some key point that help us to doing a good job in contain the virus is fast learning, because we doing and we learning as well. When the something some situation change, we adapt with the situation timely, and that is help us a lot. And also, I don't know, sorry. That's good. Okay, and we have a strong system response. Okay, I will tell it later. And we have a social solidarity between the citizens and the government. The Vietnamese government, that is very a key role that helped us to gain some success in contain the virus. The Vietnamese government took actions very early. We record, this is a map that I describe the pandemic in Vietnam, but sorry, I have not that update with the new one, because I did not have enough time to do that. So as you can see here, we recorded the first case from 2023 in January, and 20 days later we success to we end this phase one. I call this phase one. It can be divided into 3 phases: phase 1, phase 2, and phase 3. Phase 1, when the Vietnamese, also the other country in the world that needs to deal with like the outbreaks from the China. And the second phase is when Vietnam had to deal with the imported case from Europe and somewhere else in the world. Okay, and in the phase 1, we that take 20 days with 16 new cases to prevent the to contain the virus in the phase 1, and we have 20 days of new case, and the phase 2 take about 6 days, and with take about 100 days, and we don't have, actually we just recorded the imported case, and we don't have a community transmission during 100 days, but this is the data. But some days ago we start to record the new cases. Okay, with the phase 1, what have the Vietnamese government successfully to contain the virus, because the government took actions approach and quicker even than WHO recommendation. When WHO assessed the risk of the virus from Wuhan's mediums, the Vietnam put the virus in high risk alert and active the response system from that time on. And when the WHO said that flight restriction to mainland of China were unnecessary, Vietnam banned all the flights to and from China and closed the border very soon. And when the WHO say wearing a mask does not have to slow the virus transmission, Vietnamese government require the citizen wearing masks at the public places. And we also limit on public gathering, close the school and staying home orders and other methods. When in the phase 1, when we just detected 7 coronavirus patients, we put all the province in lockdown, in quarantine. So like there's some case, but we took the action very earlier. So and the government competent leadership and reliance on public health experts to guide has been the key factor to Vietnam's success so far. In Vietnam, the COVID-19 response has been led by the government, military, health sector, Ministry of Health, police, and local authorities. And the citizens play a key role in helping the government to curb the virus. So besides a lot of methods that have the government to prevent the transmission of the virus, the more important thing is the citizen. They need to support the government. They need to they need to obey. They need to follow the new rule, the restriction. So that is the more important thing. So along with a lot of rules that I have that share before, the government put a lot of efforts to educate the people, recognize the risk, and encourage them and support them and help them to follow the guideline from the government. Like you can see here, the citizen they allowed to wear masks in public place, and also hand sanitizers is are taken place in everywhere in my country, and children they are educated to wash their hand very often. And besides that, Vietnam also used an effective tracing methods, and the government run quarantine. The government run quarantine campus. I have shared that the Vietnamese, the Vietnam, they don't have a bullshit and don't have a practice to do like a lot of tests like USA, like Korea, like Japan, for everyone, like for every citizen in the country. So Vietnam, we use a different methods. We use an effective tracing methods. When they detect a new cases, we will do a list of contact tracings, and we'll test for all of them contact tracing, and we order them to stay in the quarantine campus. Actually, in Vietnam, we run the government quarantine campus, so we can ensure that the citizen they stay in the quarantine campus and they don't break the law. So yeah. Sorry, this is you can see here is the picture of a quarantine, the government quarantine campus. This is the picture of the quarantine campus for Vietnamese people who returning the country from working or studying abroad. And this is the campus for the foreigners who enter the country. They need to stay in the campus for 14 days. Yes, and we provide food for them, and the quarantine fee and food is free for both the for foreigners and the Vietnamese. So in the phase 2, we have a new wave of infection from Europe arrivals to Vietnam. So what did the Vietnamese government do? We have we implemented two main strategy. The first is to prevent the imported case from outside, and the second is to stop the community transmission inside the country. And I have to say that in this periods of time, aggressive contact tracing and quarantine measures with the guidance of public health experts did helped a lot to slow down the virus and to stop community transmission inside the country. we also keep a quarantine run campus from the we also run the quarantine campus for the people who return the country. The Vietnamese, the people return the country, we still allow them to return the country, but they need to stay at the quarantine campus during 14 days. And the government, they besides a lot of methods from the health expert, the government put a lot of efforts that that educate the people and support the people and let have the people understand their difficulties and their efforts to lead the country to contain the virus. So I have to say that the government supports Green Heart and Minds among the citizens. We have the health education have been carrying out very well, very early, even when the SARS-CoV virus circulated in Wuhan. The Vietnamese people, they at that time they know, they understand about the virus and understand about the individual protection that you should take, that they should take to protect themselves, like washing hands, like wearing mask, yes, and like avoid public gathering. And also many good services have been implementing to support citizens during the pandemic time. We give them the free COVID-19 test for all the citizens and also for the foreigners. I'm not sure if that has changed in this current time, but most of the time everything is free for the foreigners and also for the Vietnamese. The Vietnamese is totally free of charge for COVID-19 test, free for COVID-19 treatment and for quarantine, but maybe for the foreigners that may have changed in some part. And you can see here, this is the we called Rise ATM in Vietnam. During the pandemic time, a lot of people, they lost their job. And so this is an innovation that people can come to the ATM, Rise ATM, and they can take some rice to feed themselves and their family. Yes, and even the people who are staying in quarantine place, the governments also provide a little financial support for them if they have to stop working and to stay in quarantine places. That is why the people feel easier and they believe and trust the government, because they are providing a lot of good service for us to help us to overcome the difficult time of staying at home and a pandemic time. And Vietnam donate also, sorry, what's going on here? Yes, I'm sorry, I don't know what's happened. Vietnam also did a lot of things to, I'm sorry, Vietnam also support the other countries, but that's by a very small things, like to donate some face mask to some country that they are in need. When we successfully contain the virus in Vietnam, the demand for the face mask and some medical equipment is reduced. So that is why we provide some to them. We use some to help other countries. But now we are facing with the freight tree. Now is the time. Let me say a little bit about the normal life in Vietnam, because we did not see any community transmission during 100 days. So life returned to normality totally. So that is why the government still advise the people take some personal protection, like wearing masks, like keep 6 feet distance, like wash their hand. But actually, the people, they forget, because they forget. Most of them, because we don't have any active case, sorry, we don't have any community transmission, that so people feel safe, and somehow they forget. But now we have to return to alert, very high alerts, because we record the cluster of case in Da Nang since 26th July, and now the government start implement the new rule of wearing mask, of washing hand, staying at home orders, and keep the social distancing, and avoid the public gathering. Before the July 26th, the Vietnamese government still allow the tourists, domestic tourists, and also the a lot of public events can happen, like sport events, like party, or like bar or coffee shop. We allow all of them open, because we did not see any community transmission, and we are doing a very good job in protecting the border. So, but now everything returned to alert. So people need to ask the doctor, accept, share at the beginning. But actually, I totally agree with him that 6 feet or the 6 feet distance is somehow difficult to allow to apply in the real time, because even me, when I try to apply when it's in real time, somehow it doesn't work. We're still close to another people. But the wearing mask is easy to follow in Vietnam, because we have a Vietnamese government, Vietnamese people, we have a habit of wearing masks every day. So even it's not the time of pandemic, we're still wearing masks. So it's work well with the Vietnamese people. I don't know why. Maybe my presentation should be stopped. Yeah, I'm sorry. Yeah, no, that's one slide. Because of like we uh, we we are experiencing a little bit shock when we are facing with the third wave of the COVID case in my country, because we believe that will like stop. We can contain the virus successfully, and we are totally safe. But actually now we are facing with the third wave of the community transmission. So the lesson from Vietnam is timely and early action. Contact tracing, we have to slow the virus transmission if you don't have ability to do a massive test. And isolation, infected, suspected, pay and close contact, we have a lot. Also, testing is the effective way to slow down the virus, to detect the infected people. But the most important thing, the most important lesson that Vietnam have been learned is we should maintain the prevention method despite no active case, or despite no community transmission in the nation. That is the lesson that we are learning, and uh, just in next some weeks, Vietnam will implement a lot of new normal rules, like Indonesia, like the sharing with the with Dr. Asep. This is the last slide that I have that I got to share with you. Thank you so much for the attention.
Okay, thank you, Sarah. Such an interesting explanation. And so I think we can learn so many things from Vietnam that can be implemented in our daily life. And for the next agenda is the third presentation from the speaker from the USA. Hello, and hello, and are you ready?
Hello, I'm here.
Hello. Yeah. But I will first I will read the curriculum vitae of the Anne Norin. Uh, her name is Anne Norin, MSPH, and she is a doctoral student at Department of Anthropology, University of North Carolina, USA. And her research interests on participatory method, migration and health, forced displacement, refuge health and nutrition and agriculture, and so many publications and so many experience of the third speaker, and everyone can see on the screen. Okay, the time is yours, and the time for presentation is about 20 minutes. Okay, thank you.
Okay, thank you so much.
Uh,
Let me just share my screen. Um, okay, everyone. Can you see it okay? Let me go to the beginning. Okay. All right, I'll get started. Thank you all for being here, and thank you to Ms. Nissan Noor for coordinating. And as well, I really enjoyed the talks by the other two speakers. And yes, thank you for having me. So today I'll be discussing a bit about COVID-19 in the US. Similar to the other two presentations, I'll be looking also at different policies and perspectives that have taken place in response to the pandemic in my country. So I wanted to give you all a little bit of an outline of what I'll be discussing today. So I'll give first kind of just a brief overview about the situation currently in my country with COVID-19, focusing not so much on kind of the history and how it's developed, but mostly on the inequities that exist in terms of who is getting infected, who is getting sick, who is getting severe disease. And then also, then I'll move on to sort of policies and responses. And I'll be talking about sort of both national level decisions that are impacting how people are experiencing the disease here in the US, as well as different local actions that are taking place in response. And then I'll just close with sort of how we're moving towards potentially towards a new normal, how that term is being used in the US, and then hopefully have more discussion as well. And I just want to say if anyone has questions as I'm going, please feel free to raise your hand or put it in the chat. And please let me know if you can't hear me well or if I'm moving too fast. So yeah. So I wanted to start with this map just because I know that a lot of times when we think about COVID-19 here in the US, the states that are really mentioned often are sort of New York, they're California, where the disease started to hit very hard in my country. However, these days, more recently, if you look on a per capita basis, there are actually more cases here in the Southeast, this area over here, through the Southeast. And there's sort of different structural reasons for that. There's different political reasons for that, for why we're seeing these trends. And we can discuss those more as we go along. We have crossed 4 million cases in the US. It's an unfortunate milestone. And there's, as I'm saying, there's a lot of difference based on where we're living and certain demographic factors as well. So this has been kind of the geography of the situation, and then this figure can show us more about who is at risk. Oh, I see someone raise their hand. Does someone have a question? Anyone? If you have a question, you can feel free to ask it. I can't see who's raising their hand.
Okay, you can continue your presentation, please.
Okay.
And the question will be discussed in the discussion session. Okay.
Okay. Okay. My mistake. In that case, please hold your questions till the end, and we can
Sorry.
discuss. So this is basically showing, the different risk according to age as well as according to race. So in the U.S., we have a lot of issues with inequity on the basis of race and discrimination that takes place. So as you can see, many people who are getting sick are Black and Latinx. This chart doesn't show Native Americans or Asian Americans and Asians, but those populations also have higher rates of COVID-19 as compared to white people in the US. And this really shows the systemic inequities that exist, in the workforce, in the healthcare system, across the board. So yeah, I know this slide has a lot of text, but bear with me because this is also part of understanding the situation here. So again, the people who are being very affected by this are people of color disproportionately, as well as essential workers. So farm workers, people who are working in the food service. We've had a lot of outbreaks of the disease in meatpacking plants where workers are exposed to the disease. And this is really important because even though these workers are considered essential for how the country operates, they often are not given sufficient protections. They're not highly paid. So this is a major issue in that the people who are really essential to this country continuing to run, to people continuing to eat, are not receiving the support and protections that they need to stay healthy, while also continuing to work. Okay, so then also people with underlying health conditions, and of course this is not unique to the US, this is the case everywhere, that people who have underlying health conditions are more at risk of severe illness. However, I just wanted to raise this point because a recent study that looked at these conditions in over 3,000 counties here in the US found that almost half of the adults that participated in their study were having one or more of these underlying health conditions. So it's quite a lot of people who are at risk of severe disease here in the US. And then in the interest of time, I won't dwell too much on these last 3 points, but I did want to mention that people who are living in nursing homes as well as other forms of group housing, so held in detention centers or prisoners, are also at risk, as well as healthcare workers who are on the front lines of treating people with the disease. So now I'll shift into just talking a little bit about some policies that have been implemented and sort of what life has been like here, similar to what the other two speakers shared. So again, I want you all to keep in mind that here in the US, there's a lot of variation in terms of the policy response to COVID-19. So in the US, we have basically the federal government at the national level, and then each state has its own government as well. So a lot of these implementation policies are happening actually at the state level. So I want you to keep in mind that depending on where someone lives in the US, the situation can be very different. So again, the same as the other two speakers were sharing, we have some similar policies, such as wearing masks, encouraging hand washing, encouraging distancing. There have been different stay-at-home orders and closing of schools, as well as recommending quarantines. And there has also been some income support for people who have lost their jobs as a result of COVID-19. However, this is very different depending on where in the US you're living. So this picture is of people in the town where I'm living, and they're waiting for to go into the market because they're limiting the number of people who can go and shop in the market at one time. And you can see they're very spaced out. However, this is not the case in all parts of the US. There's definitely some states that don't have many or all of these precautions. And also the timing has been very different. So that's something also to keep in mind. At the same time, at the national level, there has not been a lot, well, there have been policy decisions made, but they have not always been very efficient, very effective. And so right now we have this president, Trump, and he has actually stated that he will not consider passing a policy of having people wear masks at the national level. So this is an issue. And again, at the state level, some states have this policy, but as a nation, we don't have this policy. And then another major point that I also found very interesting from Ms. Hua's presentation about how, how quickly the government responded and put out information, educated people, raised awareness. We did not have that in the US as well. So on the other hand, we actually have a lot of misinformation going around, and some of it is coming from a very high level. So this is very concerning. It's caused a lot of confusion among people and a lot of inconsistency in how policies are being rolled out. And then I did also want to mention that there's different approaches in terms of funding. So these are also mandated on some level by the national government and then on some level by the state government. So it's important to keep in mind that one of the organizations that in the past has really been essential in trying to address different diseases, both in the US and abroad, is the Centers for Disease Control, or the CDC. Excuse me. So the CDC has actually experienced a lot of budget cuts under this current administration. So they don't have the resources that in the past sometimes they've been able to use in order to, do contact tracing or do responses, or they're basically a group of epidemiology experts. However, they don't have many resources right now in this current political climate. And also at the same time, there's less funding for testing. I think it's really important what Ms. Hua mentioned about, that the US can fund testing, and I completely agree that the US can fund testing. However, the funds are not being allocated for testing, and this is a political decision, basically. So this is also something to keep in mind. Another point with the funding that I wanted to emphasize in terms of different policies is this, there's a more recent issue around schools reopening. So most states closed schools last year in March, which is when the virus started spreading a lot in the US. So it was a very late closing. It was a very kind of reactive closing. So there's that. So those schools have been closed basically since last March. And normally in the US, we have the summer break at this time. And then usually in August, we open the schools again. So this year, the students have been at home over the summer, but the schools are now considering that maybe it's not a good idea to reopen as normal. They're talking about different approaches, like maybe having students come some days and not other days, or trying to do some online learning activities. So these are responses that the schools are considering. However, the federal government is actually threatening to not allocate funding to schools that choose to reopen. So they want schools to reopen completely. They don't want them to take different precautions, basically. So these are some of the concerns around the policy decisions that are being made. So just to kind of recap, we have some positive policy decisions, as well as some ones that are somewhat concerning in terms of controlling the disease. I also did want to mention, as sort of a more hopeful note, because I realize that a lot of what I've shared has not been on a very positive note in terms of responses to COVID-19 here in the US. So I did want to just mention some of the more local actions that are going on. So we have, some people have taken up sort of the mutual aid approach. And this is something, I'm not sure, it's something that was fairly new to me, but it's basically groups of people who want to support each other. So, you know, within a community, it's sort of pooling resources, sharing resources so that you can support each other. And this has been happening on the local level. There's also different organizations and movements to actually link restaurants with healthcare workers. So in this COVID-19 situation, there's a lot of restaurants that are struggling. People cannot employ their workers because fewer people are eating outside their homes. So as a response to that, people can donate, and then these organizations will buy meals from these restaurants so that they can continue to stay in business, they can continue to keep their workers employed, and then they can give those meals to healthcare workers who are under a lot of stress because they're working a lot to address this. So those are two things. There's also different neighborhood level food distributions. And this is sort of responding that, okay, some of the neighbors in the community are elders, they are at higher risk. So this is another way that communities are responding and people are supporting each other. So I'll kind of leave with this message, kind of close with this message of that in the US, we don't so much have a policy of the new normal that is being implemented consistently. We do have some efforts, some different policies at both the local and national level. It has become a very politicized situation in the US, and it is also kind of showing up the different inequities that exist in the country. So the hope, though, is that, you know, since this pandemic is really shaking up these systems and really putting stress on the systems and showing where they are flawed and where they're broken, that there's also potential to kind of build in a direction that is more equitable and more sustainable. So that's the hope. So that'll wrap up. Thank you very much. And I think maybe we move for the panel discussion or additional questions. But thank you all.
Okay, thank you, and for the presentation. And now we will continue to the next agenda. This is the discussion session for all of the audience. If you have any question or there is unclear information that presented by the three speakers, you can ask by the writing the question in the chat room. And now there are five questions from the three persons. So the question from Mr. Mulyadi Maruni. He has two questions, and the first is, what is your opinion about the new normal life in Indonesia, Vietnam, and USA? Because according to the problem for the contact tracing, massive detection through COVID-19 has not been maximized. maximate. So the virus spread map is unclear. For example, in Jakarta, Jakarta is the capital city Indonesia. It appears that cases continue to grow. It is not impossible that there are similar cases in other regions in Indonesia, but it cannot be confirmed by the result of the test. Okay, for Mr. Asep, Dr. Asep, to answer the question from Mr. Mulyadi.
Okay. Thank you very much, Mr. Mulyadi. Oh, about my opinion. In actually, to implement new normal life, we must consider with one of all is age indicator in Indonesia, age indicator about COVID-19. Uh, if our age indicator of COVID-19 is below 0.1, it is possible to to apply the new normal life. Actually, unfortunately, this is my opinion. Unfortunately, actually in Indonesia, age indicator is still in 2.5 maybe. So it is higher than the threshold that this is the consideration, one consideration if we want to do a new normal life. So my opinion, this is not suitable for Indonesia now to apply new normal life because the number of age indicator is more than one. First, my consideration is and second, the massive test it has been done in very good technique and very spread to every area in Indonesia. So we know that in Java Island, maybe now there are decreasing the number of COVID, but in West Indonesia, this is a starting point to now the July last maybe in the middle of July, this is starting point to increasing the number of COVID-19. So that's new normal in Indonesia not suitable for all area. Maybe for Java, Jakarta, and and surrounding is very suitable. But for East Indonesia, this is not possible for now. This is my opinion, maybe. This is thank you. Okay, this is my opinion. Okay, next.
Can I answer this question too?
Thank you, Dr. Asep. And for Sarah or Anne, are you ready to answer the question? The first question from Mulyadi.
The question about okay. The opinion about the new normal life in Indonesia, Vietnam, and USA, right? The question?
Yes.
Yeah, okay. Firstly, I want to answer the question about the contact tracing, because these methods work very well in Vietnam. And if you read some publication from the expert across the world, the contact tracings and early isolation and quarantine still help a lot to slow down the virus, even despite the different levels of pandemics of COVID-19 case in the country. It still have a lot, but it is not the only way to slow down the virus. We need to mix and cooperate, apply a lot of methods at the same time that we have. But I have to say that contact tracing still have a role to play to slow down the virus. And about the normal life in Vietnam, actually, I have that shared with you that the totally lockdown in my country that took only 1 month. So that is not a very hard time for people to follow. if it is the 1 month is okay to people to enjoy staying at home, right? But if you require the people to staying at home for 3 months, 4 months, there are a lot of mental health problems with them. So the first thing that the Vietnamese government do is put a lot of efforts, the very strong efforts to slow down, to stop the community transmission at the beginning of time. It is strategy of the Vietnamese government during 3 phases of COVID-19 pandemic in my country. So when the COVID-19 case is soaring very, very fast, the normal life, the rule, a lot of rule you need to apply for yourself to protect yourself, right? And if you don't follow, the governments will punish you. In Vietnam, the government will punish you if you don't wear a mask in the public place. But when the COVID-19 case decline or is flat, or is there is no active case, there is no community transmission, you can relax the restriction. So I mean that the new rule should be depends on the situation in the country. Yes, that is my answers.
Okay, thank you, Sarah. And the next, hello, Anne. Can you answer the first question from Mr.
Yes.
Mulyadi? Okay.
Yes, Mr. Muliati, thank you for that question. And I feel like you're bringing up an important point. I really want to agree with what the other two speakers have shared already. I agree that contact tracing is an important measure. Here in the US, there has not been as strong a response with the contact tracing. There's been some initiatives for training contact tracers, but unfortunately, it has not been widely rolled out throughout the country. And I think what Ms. Hoa was saying in her presentation about kind of the social solidarity, I think that's another issue here in the US that has somewhat hampered that effort, as well as somewhat lack of a social support from the government for people who have COVID-19. So I think there's different approaches, as both the other speakers shared. But that's my opinion about the situation here specifically, that these measures could be more thoroughly rolled out if there were the political will for that to happen.
Okay. Okay, thank you, Anne, for your thanks for your explanation. And the next question is from Mr. Mulyadi. And the second question is how the implementation to doing the education and studying in the new normal life during the pandemic, because I'm worried in the school or campus will become the new cluster to spread of COVID-19 will be second wave. And this for three speakers. The question is for the three speakers. So for Dr. Asep, please to answer the second question from Mr. Mulyadi.
Okay, thank you very much, Mr. Mulyadi. This is my consideration too. That I think that schooling for now is not suitable to do as usual. So I very agree if our government make a rule that study done from the home, because in my opinion, campus of a student in university, it is very easy to control, very easy to educate about new normal life. But actually in elementary school, I'm very worried for their health, for the student health, because in elementary school, the age of 7 to 12, maybe until 15, it is very difficult to control, to educate, to make confirm about new normal life. Yeah, so I'm very agree if in elementary school, maybe after in the middle level of school in Indonesia, it must still offline study. So in my opinion, it's like this because if we talk about the student in university, they have consideration, they have a good think about normal life. But for age 7 to 15, it is very, very difficult to educate, to apply a new normal life for every student. This is my question, my answer. Sorry. Thank you.
Okay, thank you, Dr. Asep. And the next, Sarah, can you answer the second question from Mr. Mulyadi about the education in during the pandemic?
Okay, I got it. Thank you for your question. And actually, when the virus appears in Vietnam, the government very soon they close the school very soon they close the school because they really worry that the school will be the new cluster of the COVID-19 case. So because we take the action in very early play in very early stage, so the time for us to experiencing the very deep the uncomfortable life is very short. But in Vietnam, we still combine some methods that help us to eliminate the risk. We cannot remove the risk totally. So you have to combine, but it should be aligned with the COVID-19 situation in your country. If the COVID-19 case are still rising very quickly, I recommend that we should close the school as soon as possible. Yes, and if the COVID-19 is in under the controls in your region, we can mix two methods of online learning and also the class learning in the class. We can mix between the two methods, we reduce the time that people have to meet each other. We reduce the times that people meet to each other and transmit the virus, but we don't remove all the class. Online learning we can somehow we cannot do all the time, right? So we mix between the two methods, like the way we eliminate the risk.
Okay, thank you, Sarah. And the next, how about your opinion and
Yes,
yeah.
we're facing this here in the US as well with the school years approaching, and we're still even in the first wave in many places. We haven't controlled the first wave of the pandemic. So definitely it's a very major concern that schools and university campuses will become new clusters of infection. And I think, I mean, my opinion, as you know, I teach in a university. I'm also a student in a university, and it does seem much more feasible for university students to move online, especially in the US. We have the capacity to do this. However, schools and universities sometimes would prefer to stay open so that they can, for economic reasons, basically. So universities are basically weighing the concerns that, okay, now we're in this situation. We did not address the pandemic early on. So this is a situation that we're now in, and they're trying to weigh those pros and cons of opening and allowing students to return to campus, and then also the potential negative health impacts. And I really agree with what Dr. Asep was sharing, that it's more feasible at the university level in many, at least here in the US too. for have students to learn online, but for the younger children, it's very difficult, especially because if the students are at home, then oftentimes their parents also have to stay at home. They're not able to go to work, so this is also having a lot of economic implications as well. So yes, in brief, I definitely agree that this is a major concern, and different schools in the US, both universities and elementary and high school systems, are taking different approaches to this and trying to weigh different measures based on their particular situations on the ground. But there's also other political factors coming in to create different pressures in one direction or the other.
Okay, thank you. And for the next question is from Dr. Kusnadi, and he wants to know about how can the government and people do to change the habits of life health in our country. And the second question is for Mrs. Sarah. What kind of tracing method for COVID-19 in Vietnam that used in Vietnam, rapid test or swab test for tracing the case, positive case in Vietnam? Okay, for Dr. Asep.
Thank you very much. Thank you for Mr. Kusnadi. He is actually my college in graduate student. Yeah. And when I'm younger with him. Okay, thank you, my friend. I try to answer your question that how to change our habit. First, for government, it is for the first, government must issue the clear rule about how to apply new normal life in daily activity. Because until now, people very, very confusing. What about a normal life? How to implement this in our activity? It is very confused. So the rule must very, very clear from the government. And the second, government can force to people to implement the regulation. It is for government. And for the people, government, you can use a public figure, can use the religion leader to ask people. Because in Indonesia, there are one predisposition factor that religion leader is very, very important to change the habit of people. So that I think we must do the full effort, full effort to change our habit. And for us, please open our mind, please open our mindset, please see our really condition. This is not a normal condition, this is not usual life, We face a very, very hard pandemic. So if we don't adapt, we don't change our life, we can lose. We can get anything. So we can lose everything we have if we don't change our life. So please, everyone, everybody, open our mind, see the real condition. This is very, very important because I know as a government employee, I know the government try very, very hard. But if the people do not the regulation that government issue, this is nonsense. This is nonsense. Actually, I face in every day how very, very difficult to change people by the regular education. So I try to use a leader, a religion leader, public figure, and so on, that have people to change the people mind. I mean, this is a little bit effort that must be done. Okay, maybe this is my question. Thank you.
Okay, thank you. And for the next question, Mrs. Sarah,
The next question.
about, about rapid or swab tests that used in Vietnam.
Yes, contact tracing in Vietnam normally we begin with the someone who developed. That is one example. Someone who developed the symptoms. So we will do a list of contact tracing. Then we will contact them for testing them and also order them to stay home or to go to the government run campus, quarantine campus of the government to stay there. So that is the kind of contact tracing that the Vietnamese government doing here in my country. And about the test, rapid test or swab test, actually we do the rapid test, but if we still, the rapid test have some hours incorrect result. So it depends on the situation. Sometimes we use the rapid test if we assess if the risk assessment is low. So we use the rapid test, but if the risk assessment is very high, we need to confirm the case correctly. So we do a test again and again, maybe 3 times to 5 times in different places, in different institutes, different labs to ensure that the 3 labs have the same result of positive or negative. We do it in 3 times to 5 times to confirm the case. We don't, because the test still have some percent of incorrect result. So the Vietnamese government, we use the plastic and we use test, but we conduct 3 or 5 times, and we send to, in some case we send to different labs and to confirm the test again.
Okay, so it can be included that the government of Vietnam use both rapid and swab test according to the situation,
Yes.
right? Okay.
Yes,
Thank you,
right.
Sarah. Okay. And the next question is from Erigana, and she want to ask about what about the infodemiology that caused the minute information on COVID-19 news that developed at the time. And the question is for Mrs. Sarah.
Oh, sorry. Can you repeat? I just look at. Can you repeat the question?
Okay. The question from Erigana, and I will read it. Salute to the government and the people of Vietnam in facing the COVID pandemic 19. And the question is, what about the infodemiology that caused the minute information on COVID-19 news that developed at the time?
Uh,
Infodemiology.
in
Infodemiology.
for epidemiology. Yes, actually, the epidemiology information, thus some people who have some knowledge about that can understand and can read, right? So in Vietnam, the citizens will know all about the new cases or new suspects or new people in quarantine very soon by TV program or social media. In social media, because the Vietnamese people, we love social media a lot, so we share many posts of the new COVID-19. So we have the old people updates with the new situation, the new cases on the new region of COVID-19. But the data of the epidemiology data of COVID-19 are still available in many websites. You can search, the people can search from the website of even WHO, even the Ministry of Health, and the Vietnamese government also create their own website to provide the updates information about the COVID-19. Then all people can access the website, and also they also develop some application on phone and that is very easy to get the data. But because Vietnamese people, we don't use the English. English is not even not my second language. So if the foreign expert want to know about the data from Vietnam, maybe they will find a little bit difficult for them to get the data. But actually, for the Vietnamese people, we are very easy to get the information correctly and very timely.
Okay, thank you, Sarah, for the explanation. And because the time is limited and the time is up, so I'm sorry we cannot answer all of the questions in the chat room. And so we have to close our meeting. But before closing our meeting, I wanna ask to the every speaker for giving the closing statement. And the first from Dr. Asep, please give. Could you please to give the closing statement?
Okay, thank you very much. My conclusion is new normal life is one of our effort to handle the COVID-19 because the pandemic COVID-19 need the very hard effort from every sector, from everybody, from the government that must be issued the clear regulation from society, from people that first we must take hand among us, make a solidarity among people, and then the very important is back to our to everybody, yeah, to change the mindset, to change the habit, yeah, to change the lifestyle to clearly and healthy lifestyle. This is my conclusion. Please everybody, please everyone, COVID, yeah, must handle with us, with everybody, not only government, not only the other people, but everybody. This is my conclusion. Thank you very much.
Okay, thank you for the closing statement from our speaker. And the second speaker, Miss Sarah, could you please to give the closing statement in this webinar?
Okay.
Hello.
All the methods, all the necessary methods, Dr. Ashab have thus helped me to say. So I just have a very short conclusions. People in safe
Yes.
mean you are in safe. So please protect people. Mean you are protecting yourself and your loved ones. So please think about the protect people first. Yeah, don't
Okay.
put yourself first. Please put the community first.
Okay.
Okay. Thank you. Thank you, Sam, for the nice statement. And the last one from Miss Anne, please give the closing statement.
Yes, I mean, I also want to echo what both Dr. Asep and Ms. Hua shared. I really agree that it is, a community level effort that everyone has a role to play, that it will really take working together between government, between civil society, between at the community level, healthcare providers, and each and every one of us. I also definitely, I think that experiences like this are really helpful because sharing information, it is a pandemic. It's affecting countries around the world. So I think that initiatives such as this one to share experiences and to learn about the situation in different places are really valuable. So yeah, I'm very grateful to have heard, to have participated today.
Okay, thank you, Anne, for the nice statement. And I wanna try to conclude that the key factor for successful in controlling pandemic of COVID are there is a collaboration from the government competent leadership and then the public health expert and the last one from the awareness of citizen. So everyone has take a part in controlling the pandemic of COVID. And before leaving our meeting, uh, for everyone, please turn on the camera because we will take a picture together. Mohon untuk menyalakan kameranya ya, karena kita akan ada sesi foto bersama ya. Dirapihkan dulu rambutnya sebagai.
Oke.
Oke. 3. Oke. 3, 2, 1.
Oke, sip.
Udah belum? Oke. One more. 3, 2, 1. Okay, thank you
Please.
for all of the attention.
Thank you very much.
For all of the speaker, Dr. Asep, Mrs. Sarah from Vietnam, and Miss Anne, thank for being willing to be a speaker here, and for all of the audience who has participating in this agenda. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Nisa. Thank you, everyone, for taking place.
Thank you, Anne.
Thank you, Anne. Thank you, Asaf.